Osteoporosis is a disease, essentially the thinning of our bones, and it makes us more susceptible to fractures. So essentially, we lose bone density as we get older, and this happens to most people. And what we don't want it to happen is to get to a point where it gets so thin that we're given the diagnosis of osteoporosis. As we get older, especially for females, our estrogen level drops at menopause, and that causes a change in our bone density. And so we lose density as we age. It's just a natural process. But for some, it's faster than others. And that can be because of family history, lifestyle choices, a number of different things. So we do screenings to prevent, to find and hopefully identify those at higher risk for osteoporosis and fractures before they happen. There are definitely some things that increase your risk, for sure. So alcohol use, especially heavy alcohol use, and smoking, increase your risk big time. So if you avoid those things, those are some really good things to do. But also to make sure you're getting plenty of calcium and vitamin D pretty much all through your life, to keep your bones as strong as they need to be to kind of build that good foundation. And then along with that, weight-bearing exercise is very important. So walking is a fantastic exercise, but adding in a little bit of strength training is also a good idea, because that helps to strengthen our muscles, and our muscles help to support our bones. Unfortunately, there's not a lot of overt signs that you have osteoporosis. But of course, for any women, as they start the process of menopause, it's something to start thinking about. And there are some things like you can lose height as you get older because of the loss of bone density in your spine. A very late sign that we hope doesn't happen is a fracture. But ideally, you have screenings before you have any signs, so you're aware and ready and know what you need to do to keep your bones as strong as you can. If you have concerns about your bone density, I certainly recommend that you talk with your primary care provider. Most primary care providers are very familiar with this and can help you and give you suggestions to keep your bones as strong as you can, or if you qualify, to start screening to arrange that bone density test for you.